Conversations with Nicole. Conversations with Nicole. Let's talk about it. Tell me all about it. I'm here. I want to know what's on your mind. Ooh, the world needs to hear from you, and I'm so glad to have a conversation to reach the nation. And it's all about you. We'll help each other to discover innovative ways to positively change the world. Let's talk about, let's talk about, yeah. Let's talk about conversations with Nicole.
Greetings. Happy Monday. Welcome to Conversations with Nicole. I am Nicole Everett, your host, and this is what I call Mindset Monday. Mindset Monday is an opportunity for you and me and my guests to talk about whatever it is we want to talk about. And today we are talking about the Unapologetic Guide to Black Mental Health, which I feel is just the root of all of what I am doing here on these live broadcasts. I mean, we have been talking around mental health and wellness in Black and Brown communities since November of last year. And boy, what a wonderful time we have had with all of the guests, all of the clinicians and therapists, just counselors, psychologists, psychiatrists, and it's been wonderful. And so today's special guest wrote the book on the Unapologetic Guide to Black Mental Health. So before I bring her on, Dr. Rita Walker, I got to give you all an opportunity to please, in the comments, put your city and state in so that we will know where you are tuning in from. I see you, Mr. Ozzie Daniel. Ozzie is a regular here on Conversations with Nicole, and he is a clinician out of Virginia Beach. Thank you, Mr. Ozzie. And hold on one moment. I am going to change my look for a minute because I don't like that. Okay, there we go. All right. So we have Tamika in Tallahassee, Brandy in Tallahassee, Trina in Dallas. Thank you, Trina. Miss Janita, yes, happy Resurrection Week in Tallahassee. Thank you. Appreciate y'all being here. We are live on Facebook, YouTube, and on RokuTV, via the Greater Works Network. So tell your friends, your family members, your coworkers, they need to be here. They need to be right here because we are in for a great conversation tonight. We got Rara Allen, Roz from Connecticut. Thank you for tuning in. Appreciate you being here. All right. Thank you, Trina. So this is interactive, okay? So for those of you who are new to the platform, this is an interactive live, so please be prepared to comment. I may pause and ask you all a question and ask you to raise your hand or give me a thumbs up or a church finger if you can relate to what we're saying. All right, so I am going to read you a little bit of my guest bio. Dr. Rita Walker is an award-winning professor of psychology, fellow in the American Psychological Association, and author of the bestseller, The Unapologetic Guide to Black Mental Health. She is also an expert scholar who has published more than 60 scientific papers on African American mental health, suicide risk, and emotional resilience. Dr. Walker's expertise has been cited in countless media outlets, including the Washington Post, Los Angeles Times, and NPR. She also has been a frequent guest expert on Good Morning America and the syndicated Breakfast Club radio show. Y'all got to check her out on the Breakfast Club. She is well known for engaging audiences to advance emotional wellness. So help me welcome Dr. Rita Walker. Yay!
Good evening.
Good evening. Good evening. Welcome. Thank you for being here.
Hi, Nicole. It's great to be here with you and your audience from all over.
Indeed, indeed, indeed. Satar from Jacksonville. She was on the other day. Thank you for being on here, Satar. So, Dr. Tamika Hobbs connected us, my sister, girlfriend, and yours. All right.
Yes, my homegirl from Tallahassee. We were in grad school together out in Tallahassee, Florida.
Indeed, indeed, indeed. So, FSU alum. Yes.
Yes, FSU alum.
Mm-hmm. Mm-hmm. So you have a Tallahassee connection there, right?
I do. I was in Tallahassee for 6 years.
Oh wow. Okay.
Yes,
Good
yes.
deal. Good deal. Good deal. And forward of the book was written by none other than Dr. Naeem Ekbar, who is right here in Tallahassee as well.
He is. And he's just, I don't have words. He's just an amazing human, just an amazing soul. And I was really blessed to have him write the foreword. And I do consider him a mentor. And so,
Yeah.
if folks aren't familiar with his work, please go out and look up, Breaking the Chains of Psychological Slavery, and look up his work.
Yeah, he has a number of pieces, and he is a guru of Black psychology, and so he is well respected here in Tallahassee by those who are quite familiar with his work, and so we are very blessed to have him here amongst us. So before we move on, I want you to tell the people, who is Dr. Rita Walker? Not what you do, but who is Dr. Rita Walker?
Who am I? I am daughter of Rebecca and Wilbur Walker, who is among the ancestors now. I grew up in Savannah, Georgia. So even though I did my graduate work at Florida State in Tallahassee, I finished my undergraduate degree at University of Georgia. I grew up in, running from snakes and whatnot in the summers in South Carolina. So my family is mostly from South Carolina. I thought that I was going to be an attorney because I was a good daughter, and my mom informed me at a young age that I would be a lawyer or a doctor. So I picked law because I like to talk. I thought that was a prerequisite. And eventually I had an opportunity at Georgia to kind of shadow attorneys. And I thought, this doesn't really work for me. So I'm a pretty observant person. I try to just learn from what I see around me, not always what folks are saying, but also what I'm seeing. And actually, that's how I ended up in psychology. I decided that law was not going to work. And I had to think about, well, what classes am I just curious about? And it was my psychology classes, like a lot of folks. And then, of course, I realized, well, you can't really do much with a bachelor's degree. And fast forward a few years, I earned my PhD in clinical psychology. But that's a little bit about who I am. And I live now in Houston, Texas, where I love the rodeo and the grocery store. It's not a very exciting life.
Did you say the rodeo and the grocery store?
I did. There's a grocery store here. There's some folks I saw from Dallas who are familiar with HEB grocery store. And I don't know why this store gives me joy, but I go in there, I talk to the people who are passing out the free, cheese and snacks, and I just enjoy it.
Okay, well, listen, whatever makes you happy, whatever floats your boat, Dr. Walker. Love it.
Brandy said
All
it.
right, somebody said HEB is the bomb. Okay.
Thank you, Brandy.
All right, Brandy's in Tallahassee too, so I don't know how she knows about it, but it's okay.
She said she was in Dallas. Oh, no,
Wonderful.
she was in Dallas.
Right. Janita said there's a lot of psychology in law.
There is. And I'm also a first generation college student. And a lot of, my success has been my faith, my parents believing in me. I didn't have, I guess, a sophisticated enough understanding about what psychology meant back then. But of course, now I think we all see psychology in just about everything. Like there's very little that we can accomplish without understanding, our inner workings, interpersonal dynamics. So you're right. Psychology is in law, and it's in some of everything else when we sit down and really think about it.
Absolutely. Absolutely. So before we, let me get my disclaimer together. Before we jump into the book, because I really want to know, like, kind of what prompted you to write it. I gotta read my disclaimer, so give me one moment because I have a doctor in the house. I don't want people to mistake this for therapy because it is not. All right, so all topics, past, present, and future on Conversations with Nicole are for informational purposes only. They are not to be used as a diagnosis, for treatment, or an answer to any personal issues related to the topic being discussed before, during, or after the program. All right, so we are all clear. All right, I got my aunt here from Suffolk, Virginia, Aunt Georgia. And Janita is giving you a compliment. She said, "You are radiant, such a glow."
Thank you, Miss Janitra.
All right. So, Dr. Walker, what prompted the book?
The book was probably a couple of decades in the making, to be
Okay.
honest. I didn't realize that I was just walking around with information in my head, and it would have stayed in my head, to be honest, if it weren't for the mental health crisis that I saw in the statistics, especially for Black children,
Mm.
where we were seeing serious crises. And my thinking was, I don't think anybody knows. And the book blossomed from me trying to just inform our audience, our communities about mental health crisis, that there's a crisis brewing, but also what do we do? And recognizing, and I've always believed this, that we have the resources in our communities. Like, we have the creativity, we have the ingenuity, and when we match that with the knowledge and insight, then we can create what we need. And so the book was born out of me seeing crisis. I was actually hoping that it was a blip on the screen, but it wasn't. And those data have continued. And so my goal has been always to just kind of educate and inform us in a way that makes sense for us, because we know that our psychology isn't necessarily the same as everybody else's psychology. And so we need to be able to have these real kinds of conversations in order to move the needle on improving our overall well-being and our sense of purpose in the world. But that's another, we can talk about that some more.
So, tell me about the title. Was that always the title? When you were, I know you said this was decades in the making, but had you thought that you were going to name it something else?
No, I think when I say decades in the making, it was me going into psychology. I mentioned I realized that law wasn't going to work for me, and psychology, those are the courses that made sense. But when I looked at the textbooks, I just didn't feel like they reflected us. The way they talked about depression, I was like, I think we have depression, but I'm pretty sure it doesn't look like that. And that was what I dedicated myself to, in graduate school when I was working on my PhD and the research. So I'm at a research intensive university. When you hear folks talk about a study out of university and such found, it's people like me who are conducting those studies.
Okay.
And so when I conduct those studies, I'm trying to figure out like what's relevant, what makes sense for us, for people of African descent in the US and around the world.
Mm-hmm.
And so that's the body of literature that I have been building up, looking at patterns, collecting data. And so that's what I mean when I say it's probably been a couple of decades in the making, because I've just been like reading and creating knowledge, but not disseminating it, but not in places where we're necessarily looking, if that makes sense.
It does. It does. So I want to circle back a little bit. You said that Black folks' mental health doesn't look like maybe other folks' mental health, right? Especially Black folks in America, right? So expound upon that a little bit.
Well, I'll give you an example. Like when we think about depression, which is a pretty common emotional health or mental health challenge.
Mm-hmm.
Typically when folks are talking about depression, they're saying, folks are just kind of downtrodden and looking miserable and don't want to get out of bed and, can't even connect. And that's not necessarily what you see in the Black community. That oftentimes, we are able to just like pick up and keep it moving. At one point, Michelle Obama talked in her podcast about, low grade depression. And people were like, well, what's low grade depression? Because there's this idea that we have the wherewithal that no matter how we're feeling, you can't look like what you're going through. And so if that's the case, then our depression is going to get overlooked because we're still going to work, still taking care of the children, still working, overtime, and still maybe even spending time with friends, but still feeling depressed, but doing a really, really good job of masking it. And that's something that we need to be more aware of.
Good point. Good point. Good point. So let me ask you this. Black psychology um, takes on a Afrocentric worldview, right? That looks at more of a collective rather than the individualistic, and it's just African centered. How, does that come into play in, or should let me back it up? Is there some cultural continuity, and I don't know, and I'm making some assumptions here in terms of your awareness of Black psychology, especially since Dr. Akbar did your forward. But is there some continuity that you are maybe familiar with from the continent to America in the lives of Black folks and how they function? Um, yeah, go ahead.
100%. When I was saying that we have what we need,
Hmm.
um, I was referencing, an African-centered way of thinking about the lives of Black people. So the messaging that we get is that, we can't accomplish anything. We're lazy. We're a standard deviation below the mean on just about anything that you can think of. When we have like I said, the creativity, the the sense of I can survive anything and I will create, I will make something out of nothing, like that comes from a more African-centered perspective that we have, that we are all that we need. And what has been happening is that we've been programmed into thinking that the more we approximate whiteness, and the more that we can achieve or acquire what white people have, then we'll be better off because our way of doing things has been maligned. The fact that we might have in a household grandma and auntie and cousins, and we have our extended families there. Back in the day, that was maligned as we didn't even know how to do families. Well, from an African-centered perspective, you don't just connect with even your blood relatives, you connect with people in the community who aren't related. That's how we survived chattel slavery. That when folks were sold off, to different plantations and families were separated, other families just took them in. And that's one of the ways in which we have survived. But when we get caught up in thinking about, a white or European standard is what we have to hold ourselves to, then that is going to be problematic. But when we're able to say, no, we are a special people. We know that you're starting to figure some things out, but we also know what we have in us and what we have in our communities. And to the degree that we can access that, then we'll be much better off. I'm absolutely convinced of it. And that's one of the things that I talk about in the book. Unfortunately, our unaddressed and untreated mental health challenges has obscured a lot of our resources, and then also racism. I mean, we can't get away from systemic racism that's kind of like the air. But when we get to a place where we can realize and recognize who we truly are, we'll get much farther, not as individuals, but as a collective, as an African collective. But we have a lot of work. We have a lot of work to do.
We do. I love a number of the things that you said. I'm going to bring up Janita's question. She said, if we have what we need, why are there some Black people walking around saying they are oppressed?
Yeah, that question has a couple different layers to it. I'm glad I can see it pop up so I can look at the different parts. So part of it is that we don't know. I will never forget teaching. My first university appointment was University of South Carolina in Columbia, South Carolina. And I'll never forget teaching Black psychology and a young Black man saying to me, why are we even talking about Africa? You don't see me sitting around beating a drum. And he had reduced being African to beating a drum,
Right.
because he didn't understand what resources we have in the community, the level of intellect that exists in the community. We don't know until we see it in a movie, right? It's like, oh, wow, I didn't know we did all those things, because our history has been withheld and repressed. So we sometimes feel oppressed because we don't know what we have access to. That's one part. But the other part is that racism is real. The fact that Black women have high, there's a high maternity death rate for Black women, regardless of education level. You want to go into a hospital and give birth to your child, and you're expecting these folks to take care of you. And systematically, Black women are being negatively impacted in hospitals. That's just one example. We can name anything, housing, folks having resources, but not being able to get a loan to be able to purchase houses where we want to be able to buy homes. In the school system, and I can go on and on, but I'll say this one last because I deal with this one almost weekly. In the school system where our children are, Black children are less likely to be referred for gifted programs, even when we certainly deserve to be there, but more likely to be referred for disciplinary problems. So that's where the oppression comes in. The oppression is systemic. Unfortunately, we internalize the oppression because we don't seem to, or we unfortunately don't have as much access. And this isn't everybody, to be sure, because a lot of us are more enlightened and have some sense of our ingenuity. But others of us really just look around and see the circumstances. And I think it would be hard to look around and not feel like, you're in quicksand, just kind of fighting to get out day to day to day.
So tell me from your perspective about 2020, in particular, with the death of Ahmaud Arbery, Breonna Taylor, George Floyd, and how I don't know, it was the George Floyd in particular was like the murder heard around the world that really, you know, shined a light on um, the bias, the racism, the prejudice, the discrimination, the microaggressions. And now there's this heightened sensitivity to some degree. Now Juneteenth is a national holiday, right? And they taking Aunt Jemima off and Uncle Ben off the shelves, and all of these things, right? I guess to kind of try to correct these wrongs, if you will. Um, and so part of my experience in talking with people is that I think we had gotten so used to certain behaviors that we just kind of normalized it, right? So the microaggressions at work, in the office, about various sundry things, we just kind of, it's just like, okay, it's just something I got to deal with. It's like being hazed almost, right? And so I guess I want to hear from you, like what that, if you experience some, of your friends, colleagues, or what have you, just being kind of exhausted during, especially the summer of 2020, it seemed, with all of that, and how, the book may even address some of those feelings.
It's interesting that the book did come out a few months into the pandemic and 3 weeks before George Floyd was murdered.
Mm.
And you're right, it was the murder seen and heard around the world because we were all at home because of the pandemic.
Right.
And it's interesting how I think, unfortunately, timeless the book has been, in part because racism is timeless. I just think of all the people who have been murdered since then, since 2020. The thing about racism is that I don't think we actually realize how problematic it is for us, racism and microaggressions, because they seem so normative. We're so accustomed to making adjustments in anticipation of possible racism. Like physically, that's not sustainable. And it's one of the reasons that we see high blood pressure and heart disease, because the body is holding racism. And I talk about this in the book because I'm pretty sure most of us don't realize the impact of racism. And I'll give you an illustration, because a number of us have heard of, fight or flight. It's expanded. It's now fight, flight, freeze, and it might have a fourth part. I don't remember.
I think there's another F.
But the body doesn't know the difference between, a police officer, holding a weapon at you, and someone in the environment who either just called you the N-word or said something like, oh, you're so articulate when you got a college degree, right? The body perceives a threat, and the mind has said, I don't know what to do with this, but this is something that is threatening to me. The body kicks into, we have to gear up. The body, it's the sympathetic nervous system. Like, you don't have control over whether your heart beats or not. Like, that's the sympathetic nervous system. It kicks in and says, okay, we got to get ready to fight, or we got to run. Either way, we got to get ready. And so for African Americans, the body is chronically getting ready, chronically trying to deal with these transgressions that are happening. But that's not natural or normal. And so that's one of the reasons why, I'll say to folks, first of all, try to turn off the TV. Don't keep watching these things over and over again, because it does impact us. Even if you're not there, we have vicarious trauma that we can experience when we see these kinds of things. And so we have to make sure that we're aware of what's going on for us. Some of you will notice you're watching something on TV and you're like, here we go again, and your body tenses up, your chest tightens, and it's just like, we just don't know what to do with it. And we have to be able to be mindful in those moments and just breathe, to kind of settle down the sympathetic nervous system, kick the parasympathetic nervous system into gear to kind of help us relax to a place of homeostasis. Because so many of us are just, on stressful job situations. You got that manager or that supervisor who gets on your last nerve, and they don't treat other people the same way, but you got to work, right? Like the body is dealing with this. And we talk about it. You mentioned it already, Nicole, like we just exhausted. Well, this is why, because we were chronically managing stuff, not just at work, at the grocery store, not HEB though, but at some grocery stores, traveling with our families, with healthcare, and we're managing a lot of it. And we might not look like it, but it's taking a toll.
Ooh, you said a whole lot, ma'am. She said not HEB though. That tickled me right there. Listen, y'all, we are carrying this. And so now we wonder why we have high blood pressure. We wonder why, we are prone to maybe strokes and heart disease and all of these things, because it's physically affecting us, and we really didn't know why. So like man, that's powerful. So the science behind this is the thing that we don't recognize,
Yeah.
right?
The science is robust. I mean, it really, it really is. And so this is something else that I tried to introduce in the book, because I care about Black people. So, it's not just even in the psychology, it's our overall well-being. And so it's the mind and the physical body. And it's always fascinating to me that we somehow think that we can get around, without our minds. It's like, okay, I'll just kick in the autopilot and just press play. But we have to be able to take care of our minds in order to have a fully functioning, physically healthy body. I'm sure that there are folks who may be listening who have been diagnosed with type 2 diabetes. And the doctor says things like, you got to exercise, got to, take your medication, get your insulin regularly, you got to eat right. But easily 50% of people who are diagnosed with type 2 diabetes are dealing with symptoms of depression. And with depression, you're inherently having less energy to be able to do all those things that the doctor is talking about. Meanwhile, some folks are beating themselves up. Other family members are looking at them like, seriously? But those folks are managing depression. And so we need to be able to understand, all of these connections. And so that's why one of the reasons I say the book was 2 decades in the making, because I put all of this, I put it all in there because it's all connected. And there's probably more that I could have put in there, but the publisher, they were like, we can't.
Suggested issue. Yeah. Right. Okay. So my aunt asked, what's the name of her book? So if you don't mind, Dr. Walker, just hold the book up for us, please. It's the Unapologetic Guide to Black Mental Health. Unapologetic Guide to Black Mental Health. And we will tell you how you can access it at the end. All right. So, Satara, who is in Jacksonville, she is a clinician. She said, "This is the state of the society in which we live. What's sad is that this is our norm. Parents are having conversations about life lessons that now must include how to stay alive when they interact with the police." Yes, amongst other things, right?
Things. Yeah.
Amongst other things. So let's talk around like why we even have to have an unapologetic guide. And I want to just real quick, like before we kind of really dive in, like why unapologetic?
It's unapologetic for two reasons.
Mhm.
And one I'm sure will resonate, well, actually both will resonate with the audience. The first is that y'all know every time we have something, it gets hijacked. And we ask, well, what about all these other individuals?
Wait,
We're not,
wait, wait,
we,
wait, wait, wait.
wait.
So you mean when we say Black Lives Matter and then they say all lives matter? Okay. All
Yeah,
right. Anyway, I digress.
that's okay. Commercial break, all lives. But we started out this conversation talking about, how we exist, how we show up, how we believe, how we talk, like all the things we do in a way that's differently. That's not to say we're not, multilingual, multicultural, and we can exist in different spaces, but we still have a unique pocket that exists for us. And so we need to just be able to talk about the Black mental health. I get that. I love that question. Depending on who the audience is, they have a different reaction to it. But the other part of it is talking about us and some of the stigma, some of the things that we say to each other when someone says they're feeling down, and people say, "Y'all know what it is." Well, just go in, go pray about it. Um, Please go pray, but maybe pray for a mental health professional. Pray for a resource to guide you to deal explicitly with emotional health challenges. We get stuck at pray about it. And I will say that some of the younger generations are at least saying, like there's got to be more to it than that. And I appreciate that. But we need to be able to challenge ourselves within our communities, with regard to how we manage our emotional health. We can't just say, like, I'm just going to keep pressing, I'm going to keep pushing. And it's 3 years later and we're struggling with social anxiety. There are resources available. And we have to get out of our programming that says, well, whatever goes on in this house stays in this house. You all know the things that we say that keeps us from getting help. We got to let that stuff go. We got to let it go so that we can get to our true power.
Yes, absolutely. So you actually addressed my first question, which was around combating stigma. So, like you said, yes, you can pray. You can pray and also go see a counselor, and also go see a therapist, because God made counselors and therapists too. Made psychologists, made psychiatrists. So you can do both. They can coexist.
Yes, absolutely.
All right. And then you mentioned the whole what happens in my house stays in my house. Um, you know, that's another way that we can combat the stigma is doing away with that. From the standpoint of you need to go talk to somebody, especially if there is some toxicity taking place in that household,
Hmm.
right?
And I
Um,
do really try and, help folks out because I mean, I get it. I grew up in a Black household. I 100% get it. And I think it's also important, for the audience to know that individuals who are providing, licensed individuals who are providing care are duty bound, that whatever happens in therapy stays in therapy. Unless that person is believed to be, a threat to themselves or harm to someone else, then what happens in therapy, what is said in there is confidential. And if that person were to disclose anything about you, then they are risk for losing a license. And I don't know if we necessarily know, about the ins and outs of what it looks like to seek out mental health care. And so I have a whole chapter dedicated to that for individuals who say, okay, I've read the book and I think it might be helpful for me to talk to a professional.
Very good, very good. Now, how would you suggest, like, if someone recognizes maybe some behaviors that might be quite abnormal in a family member, and it might even be mental illness. Like how would you, what advice would you give someone that is that may be witnessing that?
Yeah, that's the question that is uh, sometimes, how do I get somebody to get help when I know they need help?
Mm-hmm.
And the short answer to that is not easy. But folks probably realize you can't make someone get help if they don't want it. I know that's hard to hear, but it really is the truth. And if each one of us thought about someone trying to make us do something we didn't want to do, like it probably wouldn't go so well. The alternative, however, is to express a concern. So, as an example, I might say to this friend or family member, you know, I noticed that you've been fill in the blank. Like just state the facts. Don't add the judgments. We like to judge folks. Like just
Mm-hmm.
state the facts.
Mm-hmm.
I've noticed that you just don't seem yourself, and it seems like maybe you're not taking care of monitoring your diabetes or following doctor. Like I noticed that, and I've just been concerned. That's it. One of the reasons that saying that kind of thing is challenging is because it makes us more vulnerable. It says like, well, I'm concerned about you, and I'm telling you my feelings, and we don't like to do that because we like to stay strong and act like everything is fine with the world. But when you see someone doing something and you communicate to them, this is what I see. Maybe they don't see it, but this is what I see. Just the fact. I am concerned. When that person is ready, they'll come to you. They'll come to you and say, yeah, I've been struggling with this, and I don't know what to do. Then is the opportunity to be able to say, I'm so glad you said something. I want to help you. Like, I'm going to help you figure this out. I'm here with you. If you just want to talk, maybe they don't want to do anything yet. Maybe they just need to be heard, because there's not always a time to just jump in and like, we're going to problem solve. So many of us just need to be heard. And it sounds kind of cliche, but when we're living in a society where people are so isolated, and y'all know with 2 years of global pandemic, a lot of folks were extra isolated, the loneliness really is problematic. And when folks just feel like someone can hear them, and when you listen, you don't listen to talk, you listen to hear, and you listen to ask questions like, oh, tell me more about that. Or, man, make a comment like that. That sounds like that's really tough. Like that's how we help people to be heard. And when people feel like they're heard, then they're more likely to come to you for help.
Great points. Great points. I like that the don't go with the judgment, because they will definitely feel that, and there'll probably be a shutdown, or they'll be kind of combative.
Yeah.
Right.
Yeah.
So all right. So my next question is around practicing emotional wellness. What recommendation would you make, or recommendations would you make in practicing emotional wellness?
This was one that has two parts to it,
Okay.
that starts with first recognizing where we are. Even though the book is the Unapologetic Guide to Black Mental Health, I didn't want to put mental health in the title of the book because I figured if it said mental health, people would say, well, that must be for crazy people. And they wouldn't read it. And the book is not at all for the people that you think the book is for.
You know what? You know exactly how we do, because there's the first thing that we say when you start talking about going to see a counselor, a therapist. That's for crazy people.
It is. No, it's not. It's for anybody who wants, even someone who feels like, they're not able to quite meet their goals. Like they feel like they're going in circles, and they feel like, they're not quite connecting. Like those individuals can also benefit from talking to an objective individual who hopefully has some tools and some resources to be able to help. But talking about mental health is something that I actually reframed in the book. And I reframed it to psychological fortitude, because we all need to be able to either go on a job or go to school or do both, take care of family, take care of ourselves, manage our emotions. And that one's important. Managing emotions, that's been getting some folks in some trouble on big stages recently. We've got to be able to manage our emotions, and we want to be able to connect with the purpose or the reason that we're here. Like, we're all here for a reason. And so if we can each give ourselves a rating, and maybe we'll do this. Can I do this now? Can I ask folks for
Yeah.
a rating? So when you rate yourself on a 0 to 10 scale, 0 meaning that you have no capacity, and that person really does want to seek out professional care. 0 is no capacity to be able to take care of work or school or family or health. Or tap into life purpose. And 10 is you're knocking it out the park. Now, in the middle of the pandemic, nobody was a 10, but maybe some folks are starting to get to a space of like, yeah, I can do all the things. What is that rating? We need to be able to be honest, with ourselves about, where we are, how we're doing. And then that rating can help us to guide or decide what we will do next. So on our rating scale, so someone is, say they're right in the middle, they're at a 5. Maybe they're not sleeping well, so they certainly can't exercise. Getting lunch together for kiddos is like, yeah, they'll figure it out. Just kind of going through the motions, that's just like feeling, kind of overwhelmed. That person might want to do a couple of different things. That is connecting with family or friends or doing something meaningful, getting those boosts of energy, like listening to your favorite playlists. We've been connecting with music a lot on a national platform, but then also finding something to remove from the plate, because there are a lot of people who are overscheduled and overcommitted who need to be able to remove something. And I know none of this is easy because we operate in autopilot, right?
Yeah.
Like, we just do the same thing every day and we hope things are going to be better the next day without our intervention whatsoever. Someone who's at a 7 might just, want to add something pleasurable to their lives. But someone who's at, 4 or lower, and they're at 4 or lower for weeks or even months, those individuals do want to seek out professional help. So it kind of depends. It kind of depends on where we are as far as the kinds of things that we can do.
All right. No, thank you for that. Ozzy was the only one that put up a number, so I'm gonna need the rest of you all to chime in. So, what number are you at? Tell them again what the scale is.
Oh, it's 0 to 10. So psychological fortitude is your capacity to be able to do your job or go to school and do homework and get it turned in a timely manner, or take care of children, or take care of, older aunties and grandparents or parents, exercise, take care of your physical health. Like, these are all things that we're supposed to be doing, right? And also connect with your life purpose. I add that in there because that's something that we all have, is a purpose. And there are some folks who may say, like, I don't know what my life purpose is. And I would suggest that maybe they're overwhelmed with other things in a way that keeps them, from connecting with their life purpose.
Yeah. No, that's good. So a lot of folks are chiming in. I am true said that's me, overscheduled and overbooked. Quaylen said 7. Pam said 6. Okay, ish. A 7.45, sir. All right. My friend out of Gainesville. Janetta said 8. All right, 4 or 5.
Yeah, so a lot of folks falling in that 4 to 6 range. There are a lot of folks who are in fact higher. Rara is at a 3. Sometimes we have 3 days, and what I would suggest is that like a 3-day here and there, like, okay, it's understandable. Life circumstances, like, life happens to all of us, but a couple weeks of 3s means it's definitely time to think about a professional, or at least connecting with close people around us, getting connected. But yeah, folks who are, hovering at that 4 to 6, I know, I see a lot of 6 days, especially here at the end of the semester when there's so many deadlines and everybody needs something. And I'm thinking,
Right.
okay, how can we find those pockets of eights? And sometimes it means I go to bed early. Sometimes it
Mhm.
means I just say, no, whatever you need, just no. Like I can't add anything. Because there are
Mm.
folks you would believe who are at 5 who are adding things to their
Mhm.
commitments.
Mm.
So that's why we
Mm.
have to start with the rating, so that we have that level of awareness to then decide, okay, do I need to, call my mama? Or do I need to call my sister? I think one of my sisters is watching from South Florida.
Okay.
What do I need to do for myself in order
Mhm.
to get that rating from a 4 or a 5 to at least a 6.5 or a 7.45?
Like ish, right? Rah rah. So you said you're looking into it now. If you need some help with, and I don't know where you are, but we can definitely get you some resources to help you with your search. All right. Marie, good evening. She's right here. Tally, she said just joining. I'm at an 8, but there are days that I may be a 7. I think it's good to have that level of self awareness. And so if we can just be mindful of kind of, where am I today? And like, why is that? And what could I do to improve that number? You know,
Hmm.
like you said, maybe if I need to take a nap or go to bed early or, you know, eat, eat.
Eat. There are folks who are, just running on fumes, and
Mhm.
then they realize, oh, I forgot about lunch.
Yeah.
Yeah.
Yeah. Yeah. Yeah.
And
Yeah.
sometimes, it can be something as simple as just a change of space, so
Mhm.
for folks who may still have the opportunity to work from home,
Mhm.
go outside,
Yeah.
I don't know, depending on where you all are, you don't want to go
Mhm.
outside in the middle of the day, it's too hot.
Right.
But if it's comfortable, go outside for 10 minutes just to change the perspective.
Mhm. Get some fresh air.
Yes, yes. It
Mhm.
really, these sound simple, um, but they really do make a difference if
They
we
do.
take the time to
Mm.
say, you know what, I'm going to gift myself with a break where I go outside for 10 minutes.
Mhm.
Sometimes if we have to think of these as gifts, then so be it.
Yeah. Okay, Rara, you're in Connecticut. All right, we still can get you some resources. All right. I am truth. I did say no to someone last week who I love dearly, but I just can't put another thing on my plate. I felt guilty about a half day, but okay about it now. Yeah. Sometimes that's it. You gotta have those boundaries. So a number of people are chiming in about saying no.
Yeah,
Yeah.
it's so, and I think that's part of being in community,
Mm.
right? Um, and especially if we feel like the person has asked and you're the only person that
Mm.
can help them, right?
Yeah.
And because we feel so connected,
Mm-hmm.
at the same time, that person may not realize how overwhelmed you are, you know, that they wouldn't ask if they knew that you had just said, if one more person asked me for one more thing, I'm going to scream. They
All
wouldn't
right.
have asked. And so we do have to be, good stewards of our own well-being because
Mm-hmm.
we can't expect for other people to know where we are. And so I can appreciate saying no and then feeling guilty for half day. Maybe next time you just feel guilty for about 90 minutes. Because and get into the practice of being able to say no, especially if you're someone, and I don't remember where that individual mentioned their PF is now, but if your psychological fortitude hovers around 5 or 6 or most days, then your default has to be no until you get up to at least a 7, 7.45, or 8 on most days.
Right, right. No, again, all good points. So, I'm glad that we're highlighting having, again, that level of self awareness and just, thinking through that,
Yeah.
really kind of, you know, not taking on anymore. And as I'm talking to you all, I'm talking to myself because I am the offender, the biggest offender of that. Um, because I want to, help everybody and do all these things, right?
Mhm.
But sometimes you just gotta say no. So I get it. I get it. I get it. All right. Janetta said instead of viewing it as saying no to someone, view it as saying yes to your well being. Very true. Very true. All right, so Tara said, okay, from one professional to another, I have to ask, is what you do to care for yourself any different from what you do for yourself? What you do to care for yourself any different from what you do for yourself?
I'm going to assume that's what you do for yourself is that the same as what you do for others. Maybe. Well,
Maybe.
we'll wait for Dr. Carr to circle back around.
Tara, give us a little more. Oh, patience.
Yes.
Okay, she said, I meant what you tell your patients.
Yeah, I would say it's pretty much the same
Okay.
because it starts with, okay, where am I right now?
Mm-hmm.
And I'm like you, Nicole. Sometimes I'm just running, 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 but after a while, I do say, wait a minute, I'm feeling a little bit off.
Mm-hmm.
Let me pause, and I'll take a moment and just really assess how I'm doing. Sometimes I might have a headache before
Mm-hmm.
I do that, but I do still just kind of stop and say, okay, where am I? But I have my music queued up. I'm actually someone who likes to go and sit, in my car in the garage. I will just go sit in the car in the garage and turn up my music, turn it up loud, just to kind of get me out of whatever it is that I'm doing. One
Mm-hmm.
of the reasons that that is helpful is because a lot of us, and me included, can start to ruminate. So something isn't going right, and it's like you just keep thinking about it and thinking about it and thinking about it. But ruminating over something rarely creates a solution.
Mm-hmm.
And so it's helpful to be able to remove yourself from that so that you can then come back with a clearer mind to be able to figure out whatever it is that might be going on. I have to be very intentional about my sleep. I am a natural night owl. Before I had a child, I'd stay up till 2 a.m., because I get my second wind at 10 p.m. But I have to be much more cognizant about, sticking to my sleep routine so that I can get at least 7 hours of sleep per night. So I can talk about the challenges and having to problem solve because I know that some of this, the things that, as you're alluding to, we're human. And
Mm-hmm.
so what do we do for ourselves as professionals? I use these exact same strategies on myself. And some days I say, like, yeah, strategy just isn't going to work today. We're just going to go watch TV because that's
Mm-hmm.
what we can do. But it is constant, like being self-aware and making adjustments is almost a job until it gets to a place where it's routinized and it is your default practice.
Yeah, no, good, very good points. And you called it ruminate?
Yes. So I'm sorry. I saw Ozzy's question about me having a big cup here.
Oh, yeah,
Um,
that's Ozzy,
it's
our old
water, to be
comedian.
sure. It's water. I am not a coffee drinker. I have somehow gotten through life without being a coffee drinker. But ruminating or, really is that process of, thinking some of the same thoughts over and over again, or sometimes those thoughts spiral into the next thought. And it looks like, well, what if this? Or what about that? Well, if they didn't do that, they get on my last nerve, and it just keeps going and going and going. And there is no solution in that because the rumination is happening in our head. Like it's happening completely in our minds. Some of the interruption of that is going to talk to the person that we might be ruminating about. I can't
Mm-hmm.
believe she said that. I don't know why she would say such a thing. I thought she would know better. Well, the solution is
Mm-hmm.
to going to the person and say, you know what? When you said such and such, that really upset me. Now, in order to do that, you might need to go listen to some music to kind of calm yourself down so that you don't present to that person. You don't want to come in weapons hot. You want to come in kind of calm, cool, and collected, managing your emotions. And so once you get to that place, then you can present yourself to the other person and ask about, the misunderstanding or whatever the thing is that we're ruminating about, because typically someone else is involved but we aren't talking to that person. We're just going off on them in our heads.
So I didn't know there was a term for it. I call it playing the recording over and over and over again.
Oh,
Yeah,
yes.
yeah.
Rumination. Rumination.
Mhm. So my homeboy Al said, many times as men, we don't feel like we're afforded the luxury of stepping back. We've been conditioned to be relentless.
Yeah.
All right.
But Al can be unapologetic about
Mhm.
saying, I'm going to step back now. and I'm going to empower myself. And part of my psychological fortitude in managing my emotions is I'm going to take a step back. I'm going to breathe. One of my favorite things to do, I mentioned it already, like kind of to deep breathe, to calm that sympathetic nervous system that gets into gear. And I actually have that video on YouTube because I've had people ask me about it. Like, okay, tell me about this breathing thing. Like, it really is an intentional process that you find yourself, feeling amped up, like you're ready to do something, you're kind of agitated, but you really just need to calm down, because we can relatively rarely, and I might have to think about this one, but we can't ever do anything productive from a place of anger or from a place of tremendous agitation. So we need to be able to calm down so that we give our frontal lobe, the part of the brain that engages in problem solving, we have to be able to calm down to give our mind some room in order to come up with the most appropriate response to whatever the situation might be. But again, it takes a certain amount of self-awareness in order to be able to accomplish all of that. So, but we can take baby steps. Like, that's one of the things that I try to do in the book, is to kind of like, one, share some insight, and to then start to say, okay, here's some strategies, here's some things that we can do so that we can take better control of our minds.
Okay, very good. All right, and then my final question, which I'm going to try to sneak in within our hour, is around how do we get the best care possible in a system that is steeped in racial bias?
Well, first, recognizing that, the solutions are going to have to come from within us. We have been disempowered in a lot of ways because we're kind of waiting for other people, other systems to give us a seat at the table, to create what we want or need, or give us, crumbs. And as long as we are waiting for that, it's not likely to happen in any meaningful way. The master's tools that created these racist, oppressive systems are not going to destroy or undo these systems. And so we need to be able to say, you know what? There is a different way of thinking about, the way that Black people show up. We're not folks who are downtrodden, who, can't make any sense of what's happening around us. Like, we have all the resources that we need. Let's start to put our minds together so that we can create mental health systems that make sense for us, where we are represented. So often I have folks reach out to me and ask about, referrals for mental health care. And I know they're asking me because they want somebody, who's Black. We need to be able to create, bringing resources from other parts of the community, to train folks in the community to be able to provide what we need. And we're starting to see some of that. That's one of the reasons there's so many of us in social media, who are educating the community about banking and crypto, and you name it, teaching folks about real estate. Like, we have it. But what we need to be able to do is to first recognize that we're not going to get it from those other folks, and also to deal with some of the stuff in the community that isn't just mental health challenges that we've been talking about, but understandable suspicion and mistrust that we have in the community. And once we get around that and access who we truly are, then we can create what we need for ourselves. We have historically, I think about Black Wall Street, other communities, Rosewood in Florida, where we've built up what we needed, but it was burned down. And because we lack some of that historical memory, we don't realize that there was a time, the Black Panthers did a lot, to feed people who didn't have food and provide shelter. Like, we have to get back to those places where we are providing for ourselves what we need. Is that going to be easy? No. Is it going to take place in one generation? No, but we can start to build so that the next generations have what they need despite what's happening around us.
Very good points. And you did that so eloquently. Thank you. Wow, this has been great. I really hope that folks have benefited from it, and will definitely check out the book. So how can they access the book?
Well, it's funny. My mom casually mentioned that my book was at the Barnes and Noble in Savannah, Georgia.
Oh,
Um,
nice.
and I know, here in Houston, it's at several of the, if you want to get a paper copy, I know a lot of folks want something they can put their hands on.
Mhm.
So the book is at Barnes and Noble. Check your local listing, but it's also available on Amazon, Target, wherever books are sold. The book is available, and it's also on in Kindle and also the audio format. There's a hard copy available. So the book it's readily available for anyone who wants to be able to purchase a copy.
Nice. And how have the sales been?
And how what?
How have your sales been?
Oh, well, I am really, really very grateful. You mentioned the Breakfast Club earlier. Charlemagne the God, Leonard McKelvey, who is someone who's been really very vocal about mental health, his own and for our community, has really really spread the word that the book is available, and that's part of the reason that it has done surprisingly well. And I am grateful because I wrote the book, like I said, because of crisis that I saw in the young people. But I really do believe that we as adults have to be much more empowered to help ourselves and then help our young people. But I didn't imagine that the response would be what it has been, and so I'm grateful to you and to your audience. All the great questions. But yeah, the book has done well, and I especially appreciate when folks say, like, I got the book and I got a copy for somebody else and I got a copy for someone else, and my family is reading the book together. I just can't thank you all enough.
That's a beautiful thing. That's a beautiful thing. Now, is there another book on the horizon?
Well, there is actually a workbook
Okay.
that goes with the book. It's not available just yet, but it's actually already available on Amazon for pre-order.
Okay.
It won't be out until the beginning of next year,
Okay.
unfortunately, but it is coming.
Gotcha. And how can folks connect with you?
Probably the easiest way is drritawalker.com. So that's my website. And I'm also linked from there on Instagram saying Dr. Rita Walker. You all see that Rita spelled a little bit differently because I'm from the South. So Rita spelled a little bit differently, but yes, I have my website. I'm on Twitter and Instagram and on Facebook.
Okay. Ozzy S, is it on Audible?
Yes.
Okay. All right. Very good. Very good. Okay. Well, thank you so very much for joining us and for this wonderful conversation. I definitely would love to have you come back because I think we've only scratched the surface, but this was a good scratch. And hopefully, folks got some good tips that they can utilize and, think about. I really like the psychological fortitude piece. I think that resonated with some people. And so hopefully we'll be checking in with one another and seeing what number we're at for the day and how we can improve on those numbers. All
Yeah,
right.
absolutely.
Yes. So Janita says she will increase her psychological fortitude by ruminating on tonight's nuggets. Look, you gave us some vocabulary words and everything.
I know. I love it.
I love it too.
Thank you, Janita.
Yes. So I just got to, before we close out, let folks know that we are here live on Mondays and Wednesdays at 8:30 p.m. on the Conversations with Nicole YouTube, Facebook, and on Roku TV via Greater Works Network. Live, live, live. So for your friends that may have missed this, share it with them, tag it. This video will be housed on Roku, on Greater Works, as well as on YouTube. And we invite you to subscribe because subscribing is important and we need all the support we can get. And let's keep this conversation going around Black mental health and wellness. Let's keep it going because, as has been stated by Dr. Walker, we have all that we need, and so we need to support one another and continue to encourage one another to be well, be mentally well, because there is no health without mental health. All right. All right. Wednesday, we actually have Dr. Shahiri Turner, who is the Chief Medical Officer with the Crisis Text Line. So she's been on the show before, but there's some new developments on the horizon with the text number is changing in July. So she's going to give us some information about that. And our main topic is suicide. We do a suicide talk once a month. So we'll be talking about Black youth and suicide, the other epidemic. So talk with you all soon. Have a great rest of the evening. Bye.